Good, happy Thursday afternoon, May 14, 2020. I'm Riley King, and welcome to this Thursday afternoon edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this afternoon, so let's begin. But first, we're following breaking news. Live happening right now, public health official warns Congress of darkest winter in modern history without ramped up virus response. Dr. Rich Bright, the ousted director of a crucial federal office charged with developing countermeasures to infectious disease, is testifying before Congress that the U.S. will face unpredicted illness and fatalities without additional preparedness to curb the coronavirus pandemic. Our window of opportunity is closing, Bright said. Without better planning, 2020 could be the darkest winter in modern history. Bright advised the federal government to ramp up its response a week after filing a whistleblower complaint alleging he was fired from his job leading the Biomedical Advanced Research and Development Authority for opposing the use of a drug frequently touted by President Donald Trump as a potential coronavirus treatment. And if you want to watch the live testimony, we will share the link with you after this broadcast so you can watch it. Coronavirus in New Hampshire, key information you need to know. Let's take a look. And here is that COVID-19 in New Hampshire, key information you need to know. There are 3,299 number of people in New Hampshire who have tested positive for COVID-19. 1,388,000 number of people in the United States who have tested positive. 150 number of deaths from COVID-19 in New Hampshire. 326 number of people who have been hospitalized with COVID-19 in New Hampshire. And 83,715 number of deaths from COVID-19 in the United States. This map of New Hampshire shows you current cases of COVID-19. Manchester, 471 current cases of COVID-19. This map here shows you total cases of COVID-19 in New Hampshire. Manchester, 750. Now let's take a look at these charts here. Let's begin with the new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. Current cases. In the purple, total current COVID-19 cases. And in the orange, current hospitalizations. In total cases, in the purple, total COVID-19 cases. In the orange, total hospitalizations. In the red, deaths. And in the blue, recovered. This chart here shows you by age group. This chart here shows you by female and male. And this chart here shows you risk information. This chart here shows you race/ethnicity of cases. And this chart here shows you percent of New Hampshire population. Your common symptoms: fever, lack of smell, cough, chills, and difficult breathing. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Long-term care facilities call for more testing, personal protective equipment, facilities hit hard by COVID-19. Let's take a listen to that video from WMUR News 9, Amy Cavino.
Strict attention to detail. That's what sets Kubota construction equipment apart. What's really been heartbreaking about this virus is that it really plays no favorites. And so it's hit some of the best facilities in the state.
Among those hit hard, Hillsborough County Nursing Home. 30 resident cases and 6 employees. No deaths yet. Administrator David Ross tells News 9 he'd like the ability to test his employees daily.
We appreciate the fact that the state is expanding the availability of testing for facilities. I really want to see on-demand rapid result testing, the same kind of testing that they have for the White House.
Some facilities don't have enough PPE, specifically isolation gowns.
Yesterday, I delivered 250 disposable isolation gowns to a facility. Now, prior to the pandemic, those gowns would have cost 25 cents a piece. Now you can hardly find them at $6 a piece.
News 9 asked state officials about PPE this afternoon.
I would encourage any nursing home that has a shortage of PPE to contact me, either through our ESU or to me directly. No one should have that degree of shortage of PPE that they think that it's impacting patient care.
Commissioner Shibinette says 16 long-term care facilities have active outbreaks right now. David Ross tells News 9 he was told his facility is likely pre-symptomatic, which means illness could start emerging at any time now. Praise and gratitude continue for employees.
We have staff who just heroically have stayed the course and are providing care.
Okay, and there you go on that video and that report. CVS to open 10 new drive-through coronavirus testing sites in Massachusetts. CVS Health is opening 10 new drive-through COVID-19 testing sites across Massachusetts on Friday as part of the company's efforts to help prevent the spread of the coronavirus. The new base state sites will utilize self-swab tests and are part of the first rollout of new CVS testing sites across the country, which includes 41 other locations in Arizona, Connecticut, Florida, and Pennsylvania. This marks the next phase of the company's nationwide COVID-19 testing stages, which was announced on April 27th at the White House. The new testing sites in Massachusetts includes CVS Pharmacy, 142 Worcester Road, Charlton, Massachusetts. CVS Pharmacy, 44 West Boylston Street, Worcester, Massachusetts. CVS 266 Route 44, Wareham, Massachusetts. CVS 366 King Street, Northampton, Massachusetts. CVS 9-19 Summer Street, Bridgewater, Massachusetts. CVS Pharmacy, North Main Street, Craver, Massachusetts. And CVS Pharmacy, 928 Riverdale Street, West Springfield, Massachusetts. CVS Pharmacy 311 Newbury Street, Danvers, Massachusetts. CVS Pharmacy 599 State Road, Westport, Massachusetts. And CVS Pharmacy 188 Linden Street, Walsey, Massachusetts. Those will be the locations for those COVID-19 testing sites. Maine National Guard to complete a statewide flyover to salute frontline and essential workers, whether for part of the flyover to be canceled on Tuesday. Let's take a listen to that video from WMTW News 8 Maine.
Police cruisers and fire trucks lined the streets outside of Maine Medical Center while hundreds of healthcare workers looked above to see a show of appreciation. A booming message of thanks from the National Guard Tuesday morning. In Portland, doctors, nurses, technicians, and staff poured out of Maine Medical Center as a KC-135 aircraft passed overhead, showing appreciation for all they've done over the past 2 months. Portland Police and Fire giving their thanks as well, while community members highlighted their efforts to keep the community safe in uncertain times. It flew over Farmington, Lewiston, and Portland, headed up the mid-coast, and eventually to Bangor. Minutes before, it had passed over Scarborough with a message of hope.
It was just an incredible show of support for our whole home and our whole community.
At the Maine Veterans Home in Scarborough, residents carefully lined the sidewalks,
so that they could be outside, they could enjoy the flyover, they could enjoy seeing the police and the fire, hearing the laughter and the fun.
A much-needed boost at the facility that's been hit with the coronavirus and seen deaths during the pandemic. 7 residents have now recovered, while staff focus on precaution and protection.
We have moved towards a recovery phase here, looking at how to increase their activity, decrease isolation, focus on them getting stronger.
A brief moment of gratitude, she says, was more about how it brought them and their community together.
It was great to see them outside and see them smiling. It was like the old days.
Joe Glauber, WMTW, News 8.
Okay, and there you go on that video and that report. Very cool indeed. Should face coverings be mandatory for shoppers when Vermont stores reopen? Let's take a listen to that video from NBC 5 Vermont.
The job of a service technician at Bailey Ford has changed drastically. Just think about collision alert systems, blinds.
For us to go in not masked is kind of a slap in the face.
Thea Lewis wants to see face coverings on everyone when all Vermont retailers are allowed to open their doors Monday at limited capacity.
When I see someone else not wearing a mask, it says to me a little bit that they don't care about my health.
She signed a petition asking the governor to make masks mandatory for shoppers, as it will be for store clerks. It's been a touchy subject. One Vermont Facebook user saying, "I ain't wearing a mask unless I'm tackled to the ground by FEMA themselves, and I can't spread what I don't have." Phil Scott, for now, preferring encouragement instead of tough demands.
I think a mandate has the potential to create controversy.
His state's health department has been telling folks that masks keep the virus from reaching others through the spray of a cough or sneeze, spread that could happen when you're infected, but before any symptoms show up. That education to think of your neighbor just in case has led to high voluntary mask use here.
Taking our mask with us when we go out is as important as is taking our car keys and wallets.
Mark Sherman will expect customers to wear face coverings in his outdoor gear exchange when it reopens.
We will have disposable masks ready to hand to them if they don't show up with their own.
But some other businesses fear strict requirements could lead to disputes and put workers in really tricky spots, like when 2 men reportedly beat security guards who tried escorting them out of a California box store for not wearing masks.
We're hearing from both sides.
The Vermont Retail and Grocers Association is now surveying stores in the state on this issue.
What our goal is going to be is to hear from as many of our members as possible.
It'll forward its findings to the governor, who said he is open to considering a change, but he first wants to see how next week's reopenings go. In Burlington, Jack Thurston, NBC 5 News.
Okay, and there you go on that video and that report. Mayor announces expanding COVID-19 testing in New York City. Mayor Bill de Blasio announced that the city is expanding its COVID-19 testing efforts. Now, people with symptoms, regardless of age, chronic conditions, or occupation, can get tested. Also, people who have been in contact with a confirmed patient or those who work in the congestion residential setting. 100 cases of pediatric multi-system inflammation syndrome has been detected in NYC. 55 tested positive for COVID-19 or antibodies. One child has died. It was a good day for the city with all three indicators down: hospitalizations, ICU visits, and the percentage of people on testing positive were all down. Suspect in Raleigh officer-involved shooting identified. Let's take a listen to that video from ABC 11 News in Raleigh, North Carolina.
T-Mobile and Sprint are joining forces. By bringing together our two networks, T-Mobile will build America's largest and most reliable 5G network with more towers, more engineers, and more coverage. You'll get the best 5G network and the best prices. Welcome to T-Mobile, America's largest 5G network.
Anna Rivera and Morgan Norwood, part of our team coverage working for you. Let's begin with Anna and that new video and an eyewitness account. Anna?
That's right, John. That video just so scary. I can't even imagine being inside of this gas station when all of that happened. Take a look. We want to get right to show you what exactly happens in the video. Some terrifying moments. You can see 24-year-old David Atkinson jump over the counter. Immediately, customers frantically run out of the store. And once behind the counter, Atkinson points a gun at the clerk, stealing money and tobacco products. A witness tells us he left the store and called 911. Once police received reports of that armed robbery, they responded to the gas station, and when officers got to the scene, witnesses pointed them in the direction of Atkinson. Police say as they got closer to the suspect, Atkinson and the officers shot at each other. Both the suspect and an officer were hit. One witness describes what it was like when the suspect entered the store.
So I immediately looked towards the counter, and that's when I saw a man pointing a gun at the clerk's head. And so I set the beer I had in my hand down. I made a beeline to my car, got into it, drove out onto Newbern, and immediately called the cops.
And that's when those officers got here very quickly. Those officers also wearing body camera video. We are expecting, of course, that 5-day report, which is normal protocol for the Raleigh Police Department, to release that report about what exactly happened in this officer-involved shooting. Now, our Morgan Norwood continues our team coverage. She's got the latest on that officer's condition. Morgan?
Yeah, good morning, Anna. We're live here at Wake Med, where we know both the suspect and the officer. We're taking good news this morning regarding the officer. We know that he was released a short time ago. Just amazing considering just how wild that shootout was. You're about to hear those gunshots in just a few seconds, but we were here at Wake Med just as the suspect and the officer were admitted. A swarm of officers showing up to support their brother in blue. Now this morning we're hearing those 911 calls from inside the store as the caller described describes that suspect to the first officer on the scene. You actually see him here running towards that chaos. Now, during the call, you can hear the barrage of gunshots just as more police officers pull up to the BP to arrest David Atkinson. Seconds later, you hear an officer radio out for help. Again, just chaotic. You're going to hear those 911 calls where you hear those gunshots on that call, but then you also hear those gunshots as the officer was radioing in for help. Now, we know as standard practice, the SBI and the RPD's Internal Affairs unit will be investigating. I want to go ahead and let you listen to those 911 calls in that radio traffic right now.
Hold the word. Huh? Hold the word. Shot fire, Raleigh. Shot fire. Shot fired.
2 more shot fired.
Raleigh, I've been shot. Cleared in Newburgh. Suspect down.
Again, just amazing that that officer was able to make it out of that okay, just considering how many gunshots there were. Again, we're going to keep you updated both on the latest, both on air and online, rather, at abc11.com. For now, I'm Morgan Norwood, live in Raleigh, ABC 11 Eyewitness News. Back to you.
Okay, and there you go on that video and that report. And we will be sure to keep you updated on that story. Governor Hogan's stay-at-home order will be lifted Friday evening. Some local traditions not ready to reopen. Let's take a listen to that video from WBAL TV 11 News.
This is the Doppler. And there it is. And it tells you
our state is ready for the initial recovery stage of the roadmap to recovery. It is based on the Governor Hogan's own plan that he authored for the National Governors Association. Friday, the 15th at 5 p.m., the governor's stay-at-home order is lifted, and our state will transition to what's called a voluntary safer-at-home guidance. In the phase 1, which will itself be rolled out in phases, we will see quality of life improvements and changes for businesses, for the community, and for religious groups as well. For example, Friday at 5 p.m., retail stores can reopen if they remain at 50% capacity or less. Some personal services can resume, salons, barbershops, but by appointment only. Religious services, which the governor said is so important to so many people, outdoor services will be allowed, as well as indoor services at religious facilities as long as they remain at 50% capacity or less. Also allowed to begin reopening during this phase 1, manufacturing, pet groomers, and car washes, although Governor Hogan did caution just because we have entered the first stage does not mean that we are safe.
Low risk does not mean no risk. All Marylanders, particularly those older and more vulnerable populations, are advised to continue staying home as much as possible. Employers should continue to encourage telework for their employees whenever possible. Individuals who can work from home should continue to do so. People should continue wearing masks in indoor public areas, retail stores, and on public transportation. We know that in general, outside activity is safer than inside activity, and that at all times and everywhere, Marylanders should continue practicing physical distancing and trying to stay 6 feet apart and to continue avoiding close gatherings of 10 people or more. Everyone should keep washing their hands often and frequently sanitizing high-touch areas.
A big question, what about expanding childcare for all these employees who will be able to get back in the job starting Friday at 5? Governor Hogan said the state school superintendent, Dr. Karen Sandlin, is working on a plan to reopen childcare right now, and he said it will be released next week. Reporting live from Annapolis, I'm Kate Amara, WBAL TV 11 News.
Okay, and there you go on that video and that report. Over 43,400 cases of COVID-19 in Florida. Death toll climbs to 1,875. According to Department of Health, there were 43,210 total cases of COVID-19 in Florida as of Thursday. At least 1,875 Florida residents have died from COVID-19. And if you want to see more for like each county, like Palm Beach, Martin County, we will share this link for you right on the Riley King Network Facebook page. So be sure to check that out after this broadcast. Dow claws back 458 point loss turns positive as banks rally. Stocks traded well off their session lows on Thursday as a rally in bank shares offset another dismal round of U.S. unemployment data. Record-breaking prices seen at grocery stores. Let's take a listen to that video from ABC News.
Tonight, in the rising prices at grocery stores across this country, the challenged supply chain, and grocery store prices jumping now. The biggest one-month rise in nearly 50 years. And tonight we hear from the families now skipping meals. Here's Victor Akendo on this again tonight.
Tonight, those new numbers showing record-breaking prices at grocery stores are forcing families to make tough choices.
If something's gone up $1, I'll either find an alternative or honestly not purchase it.
Kelly Johnson from Dunedin, Florida, says her grocery bill has gone up $50 a week.
These shelves used to be full, overflowing. It's looking pretty bleak. Milk's going out.
The single mother with 5 kids at home doing what she can until she can go back to her job as a restaurant manager.
We sometimes have to skip meals. We're down to 2 meals a day. It feels like I'm failing as a mom to take it to that extreme.
It's the biggest jump in food at home prices in nearly half a century. Eggs up more than 16%. Hamburger meat up nearly 5%. Chicken up nearly 6%. Some pork products up more than 10%. Before the pandemic, Americans were spending more than half their food budget on eating out.
People are staying home, they're not going out anymore, and so there's a big increase in regards to sales in grocery stores. Grocery stores are seeing on average over 25% sales increases.
The other byproduct of increased demand that's hurting families are less deals.
A lot of these grocery stores are not offering things on sale. You're really going to have to do your due diligence as a shopper because you're not going to see many promotions in these stores anymore.
These prices might continue climbing. Experts predict they could go up 4% by the end of the year. David?
All right, Victor, thank you.
Okay, and there you go on that video and that report. And thank you for joining us for this afternoon edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your afternoon. I'll see you back here later on today for another newscast. And I have a news report coming up in a little bit. Goodbye, everyone.